So for that technique, we want the patient first to relax. We don't need much. The patient's leg will be resting on a chair. And we want the patient to rest on her thigh, not contracting any muscle to keep this position. Hands are gently pushed on the laps. Now I'm going to select my contact. It's a supported index finger with supported by the third finger. I select my contact and I'm going to treat just the spinous below the interspace that I want to move. I'm going to tuck the patient chin in, move as I tucked in and keep the chin in, move my whole secondary hand down the nape of the neck. In the same time, back up my leg, tilt my contact, and basically take an orientation oblique with finger, wrist, and elbow line. I'm going to then laterally bend the patient's head to increase the tension, segmentally extend, and trust. Why balance the arc of tension? We want to achieve an inflection point at the precise interspace targeted for treatment by balancing two arcs of tension, the cephalad and the caudad. If an arc of tension is too strong, it overshadows the treatment area and it locks it. So if we have too much flexion on the head, the tension goes right where we treat the patient, won't be able to treat it. So the Gonstead chair had a tilting back feature to balance this arc of tension. And they didn't speak of arc of tension at the time. However, tilted was limited since the doctor had to relinquish his contact to adjust the chair back. The facilitation for that techniques, they are different. Some are extremely simple. One of them is that you're behind the patient, and once you have pretty much find what level you're going to tilt his upper back, you're going to bring his head down and ask him to push with his head toward you. Push, 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 push. Well, relax, and you stretch him, and push, 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 and you stretch him. Push, 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 push. By doing that, you fatigue the muscle at the lower level of the neck, and you're going to facilitate your adjustment. The other approach, same thing, a muscular approach, you're going to hold the arm like that, and you're going to say, ask him, open your arm, please. Open your arm. Come on, come on, come on, come on, come on. Relax, and then you stretch him. Open your arm. Relax, and then you stretch him. Open your arm. Relax, and then you stretch him. Those are muscular approach. Then you have more what we call neurological approach. So let's see a neurological approach. A neurological approach will use the refractory period of a muscle. One of the big antagonists to that treatment on the upper thoracic is the trapezius muscle on the opposite side of where you treat. That trapezius muscle, if it contracts, basically locks the whole area. So to avoid that, we're going to almost synchronically tap gently that trapezius muscle, leading to a sudden contraction. And for 2 milliseconds right after that contraction, that muscle cannot contract anymore. It's called the refractory period. And you have the absolute and the... okay, so by doing that little tapping, we're going to shut off that muscle. And this is how it looks. You're going to put your hand here. Beautiful. Relax one. Beautiful. And what we did here, we tapped the muscle, and fraction of a second later on, we just treated. It's almost synchronous. And if you can do that, those two simultaneous movement, treatment is facilitated greatly. Now, not everybody can do that. I've taught that for many years, and it takes around 6 months to somebody to master it. You may be faster, and I hope you are. but it's a great, great approach, extremely smooth for the patient. Do you feel it?
Yes, sir.